All right, with us now, Dr. Joe Congeni, 14 in front of 9846, and you wanted to go down the road of track and field on a couple of stories this morning.
Yeah, Ray, thanks. I couldn't help it was top of mind. I went to the calling hours last night for one of the great coaches in our area, Joe Zampino. Everybody knew him as Peach. This time of year, Peach was around at all the different track events. He always had a stopwatch around his neck. He taught the girls so much about running, but he taught them so much about life. He was a track coach, 21 years at Hoban, 40 years as a coach. And so just in honor of Peach, I was going to talk about those kids that are out running track this time of year. And one of the most common problems that we run into in track is runner's knee. Is a thing known as patellofemoral pain syndrome. It's really hard to explain to athletes sometimes.
Or?
Yeah, it's typically overuse, Ray, but it's the number one most common runner's injury, number one most common overall injury in sports medicine. And it's so much confusion about it. A lot of people run through it and they have knee pain and they come in and say, geez, I must need surgery. My knee's been hurting for 2 or 3 months. Whenever I run, my knee hurts a lot. And what happens is, there's really kind of a delicate balance around the kneecap, and if that balance gets out of mechanically out of balance, the kneecap will start to rub and get irritated and inflamed. So it can be due to the mechanics of the way you run. It can be done to shoe wear. It can be due to a lot of our runners or guys that are practicing an imbalance between the quads and the hamstring, causing that kneecap to rub in its groove quite a bit, and then kids will be aching all the time. And when they sit down, they're rubbing their knee, and their kneecap is particularly very swollen and tender, and a very, very common problem known as runner's knee. And it's not need surgery. Surgery is not the thing that's used to fix it. Really, what's used to fix it, and the tricky part about it is you have to first of all figure out, why is it happening? Is it a mechanical thing? Kind of like the way we'd explain to runners, if the car is out of balance a little, the tires will wear funny on one side. That's kind of what happens in the kneecap. And so a lot of times it's just balancing out their mechanics, or a lot of times it's just getting them on a good flexibility and strength program to balance those muscles around the kneecap. Or a lot of times it's changing their errors in mechanics. A lot of times this time of year, kids are getting ready for a half marathon, a marathon, or all those races they run, and they're doing too much too soon. And it leads to this very, very common problem around the kneecap known as patellofemoral pain syndrome, runner's knee. Many runners come in and say, oh my gosh, I've been struggling with this for years, and I wondered why it always hurts me to run. And the biggest thing, if you're a runner and you're getting pain 5-10 minutes into running all the time in the front of the knee, get into a professional that understands and sees this problem a lot, and they can do a lot of good with just some mechanical changes and physical therapy to get this thing better so that you're not always in pain.
Rest? I mean, do you have to rest?
Sometimes it's rest. Sometimes it's relative rest. We reduce their mileage. We put them on an elliptical. We get them on an exercise bike, or even sometimes if it's real bad, in the pool for a while. So we actually kind of cross-train for a while to get it quieted down. Sometimes meds help. A lot of times you'll see those taping, those really, the colorful taping around the kneecap, because we want to get the kneecap tracking normally again. And one of the first ways to get it tracking normally is through taping. In the old days, and still now, a lot of kids wear braces. You'll see girls with braces around the kneecap still very, very frequently. But nowadays, people are using tape more and other techniques to keep that kneecap in the groove so that it's not rubbing and irritated and always bothering these kids when they're playing sports. So we see it in soccer, we see it in lacrosse, we see it in basketball, but when we get into running season, this is very common. And we say 30% of runners, 40% of those people getting ready for the 5K, the 10K, the marathon, have some degree of runner's knee. And getting in when it's bugging you to somebody who understands this problem many times can take care of it within 4 weeks, 6 weeks, 8 weeks, and get rid of runner's knee.
Joe, one thing that we see that it seems to be in vogue with runners and athletes in general, and maybe this is a relationship to that, is those tight knee slip-on braces that I'm seeing all over the place. do those help keep the knee in the center, the kneecap and such?
Well, typically through the years, when you have those tight braces that some of us wear, oldsters wear, a lot of times that's for arthritis, and that just creates and keeps heat in the joint when you're running. Typically, a runner's knee brace has a hole or a horseshoe or a J pad to try to hold that, buttress that knee and hold it right in its groove.
Oh.
If you can see the groove. So typically a runner's knee has a hole on it. If you actually put some of those tight braces that you mentioned, and many kids do because they don't know better, is it actually adds to the compression of the kneecap and makes it worse. So it's one of those things you really need some guidance. Your trainers at your high school are very good. If the trainers aren't quite getting it fixed, you might want to get into somebody that has knowledge about runners. At an office like ours, we may in a month, not like now, see 30 to 50 cases of runner's knee in a month.
Wow.
So very, very common problem. And many of the kids, I dare to say right now, that are mid-season, especially the distance runners, especially those girls that Peach would be working with this time of year, many of them have runner's knee. Get into somebody who can help you finish the season strong, stay running through the summer and fall without that discomfort and pain all the time from the rubbing of that kneecap known as runner's knee.
Yeah, and as you heard Joe mention, it might go away, but if you don't take care of the root of the problem by going to see a doctor or someone who really is good in the field, it's just going to keep coming back.
It does, and it can, one more thing, complication-wise that you mentioned, can go on to arthritis later on. So we see women in their mid-20s and 30s, or men too for that matter, where now there's narrowing of the joint, spurs, and other things. So yeah, take care of it when you're in high school.
All right, Joe, good visit.
Thanks, Ray.
All right. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live in studio.